Hello. Hi, Liv.
Hi.
So, hi. So today is the 12th of July. I am Laura Maria Calderone, and this is 14 Days to Change. And with us, we have Olivia Mac, Liv, public health researcher in Sydney, Australia. So, Liv, as you know, you're our 20th story in this series, but it's actually the second interview that we've had. The first time we spoke was on the 28th of June, so exactly 14 days ago. And back then we saw how things were in Australia and just what the situation was. And now we see there's been a couple of changes. But before we speak of the changes and what's currently happening right now in Australia, I'd like to show you bits and pieces of our conversation that we've had. So let's do that. But before we do that, just so we keep in our minds, just the numbers. So the data back then, 2 weeks ago, and the data now of how many cases Australia had. So on the 28th of June, Australia had total cases of 7,686, and there were 104 deaths. Today, the latest data of the 12th of July is that Australia has 9,797 cases, and unfortunately, there's been 4 more deaths, so bringing it to 108 deaths. So I think we can, now that we have that in mind, I'm going to share my screen. So I'm going to ask you to please go on mute and let me know if you can hear and see everything well. So right now you should be seeing the video, and there we go. Liv, tell us a little bit about yourself. Tell us where you are, and let's get started.
Hi, so I am from Auckland, New Zealand, and I have been living in Sydney, Australia for 3 years. And so I work in as a research assistant at the School of Public Health at the University of Sydney.
Then you are one of the lucky few in the world right now, from a good country, in a good country. COVID, right? When we speak about the pandemic, you're in a good spot. Let's stay with Australia, since we already started talking about Australia. Tell me, aside from the outbreaks that have happened, that are happening in Melbourne, what else is in the news? Always pandemic related, but what else is happening? What is the topic that you are hearing and talking about and watching in the news?
So one thing, I guess sort of even related to Melbourne, one thing is the state borders, which are quite confusing. Some of the individual states have closed their borders to the other states, and there's been a little bit of some of the state premiers are getting a bit like almost shitty with each other. So yeah, like Queensland closed their borders to everybody for a while, and then New South Wales is trying to be like, hey, let us in, or and so they actually just announced today, Queensland, that they are opening their borders to the rest of the country, I think on the 10th of July. And other than that, I think another thing is just that, I guess, the easing of restrictions, which is like a sort of staggered approach. And I think from the 1st of July, more restrictions are lifted. So I think you can have maybe, and I think it's more than 20 people in an outdoor space. So things are sort of, more things are opening now. And that, I think that's the main conversation in the media. But yeah, it's really seems to be all about the Victorian clusters.
The Victorian cluster. Yeah. Is there anything else that you can tell us about the Victorian clusters, or something that maybe has not yet reached international news, or maybe something that should be more emphasized in international news?
I think one thing I've noticed is that there seems to be a lot of blaming of the the people. So the people that have maybe been infected working at the quarantine hotels, and they've gone home and they've created a cluster, but a lot of them are from countries they don't speak English as their first language, and they just haven't been provided with enough like infection control training, personal protective equipment, and they haven't been provided with maybe adequate communication in their language about it. So I think that really highlights just the issue of communicating properly to everybody. And I think in such a multicultural country, it's really important that all of your people are getting the same message. Otherwise, it's just going to, disproportionately affect the either like minority groups or people that are socio-economically disadvantaged. So I think that should be more of the story than
actually saying it's their fault or we did our part. But blaming others, finger pointing, even in March, April, it has shown that it doesn't help. It just makes things worse. So
there's been a lot of that. Like obviously most of the cases in New South Wales came from the Ruby Princess disaster, which instead of sort of managing that better, it was a lot of sort of finger pointing, like, oh, let's blame this person, let's blame, find the culprit, but that doesn't really achieve that much.
No, not now, at least. Better, okay, there is something that went wrong. Let's figure out what went wrong, how it went wrong, and ensure that doesn't happen again. And whatever lessons you learn from that, maybe see if they can also be implemented in other types of situations. That is what we need, right? From the very beginning of the pandemic, one of the main things that was said, aside from test, was you need to react. You can't, yes, of course, you need to study the situation and think about the situation, but you don't have weeks and months and years to discuss about it. No, it's
that's really true. And I think that's led, you have to make these decisions, those really hard decisions, very quickly, not based on a whole lot of evidence, because it doesn't exist yet, because you can't wait for the evidence.
Makes it all even harder. And talking about making things harder, as you know, New Zealand has been a story of hope, of inspiration, that just shows that when the community, so when all the citizens put their part, then things can be done. When the government is clear, gives just a transparent look at what is happening, what can happen, what shouldn't happen, and what needs to be done, things can work, right? So for a long time, and yes, there's the skepticals that say, oh, but New Zealand is so far away, and New Zealand, there's barely any people there, and that's why everything's fine. Maybe there's a little bit of truth in it. I mean, yes, there is a little bit of truth, but that's not why it has done well.
No. Well, exactly. I think it's very easy to sit there and be like, oh, you're so far away, you're so small, you're not densely populated. But at the same time, like, we started to get that sort of incline in cases. You started to get that increase and the first sign of community transmission when they shut it down. So if they didn't shut it down, we would be seeing something like a million times worse than what we actually saw. So, and like all of that is from that, like their response and that clear, empathetic messaging. And I think what they did really well was just this message of unity. It was all about, we are doing this together. We're all staying home. We're doing this together as a country to save lives.
Exactly.
And I think,
a united front, right? Something for everybody, not against something, because as you've seen, there's been some countries that have spoken about the virus as if it was an enemy and we were or they were at war, which
Yeah,
uh, I'm still undecided if it's a good approach or not.
I agree. I've been having that same sort of, yeah, thoughts about there's a lot of similarities in the terminology that we're using to liken it to like we're going to battle, like the doctors and stuff are these, you know, war front heroes. And yeah, you know, and like people that are working in the supermarket, they're on the front line. And I don't know how appropriate it is to be using such forceful war terminology.
Exactly, especially because, at least how I think of it, is that using such terminology kind of gives you or gives the country, gives the government the okay to think, well, you know, in a war you lose people, so if some, you know, essential
Mm,
workers die, yes, it is sad, but it's expected. And
mhm.
no, it shouldn't be expected, and it can't be okayed from the beginning just because you have this type of conversation.
Yeah, and I mean, yeah, like language terminology, it's so important. Um, so that's really interesting. And like, yeah, talking about the sort of your supermarket staff, your nurses, your doctors as being on the front line, it almost makes, you know, they're at such an increased risk. So if you sacrifice a couple of them, maybe you can still win the war, but that's not really what anybody wants.
No, not at all. And that's why New Zealand's approach and just their communication skills, because that's
Mm.
what it is also, knowing how to communicate in a difficult situation. Uh, yeah,
Mm.
the saying unity, what you were just saying, right? It's all of us together working for each other. And also the fact, the more you do now, the less you will have to do later, right?
Exactly. I know. Like my family went to, like my brother went to a rugby game last night, which was had about 40,000 people at, which like, you know, that's massive. No, you know, there's no other stadium in the world that's having that many people at the moment, which is really cool. And that's because they did those hard yards early and they got the message out and they all united.
Exactly. And unfortunately, barely anybody else can say that in the world.
Mm,
You know, 40,000 people at a game right now is a thing of the past and a dream of very far away future for many.
right. It
So,
was, yeah, it was really, really heartwarming. Like it got goosebumps just watching it. It's really
and
special.
did the team that your brother
Yeah,
cheers
I'll
for,
try
did they
out.
win? Yeah. Okay. That's good. Um, talking, let's stay a little bit longer with New Zealand, because you have mentioned two things. First, you mentioned a little bit earlier how Australia, the different states were looking into opening and letting other people come in, right?
Mm-hmm.
And then it just made me think, okay, one of the things that's happening here in Europe is that it's been a few days, a few weeks that countries from the European Union can have started to really travel within countries. And
Mm.
now come July, the borders will be open, the EU borders will be open to a lot of countries. I know that New Zealand, as we were saying, has done very well. And unfortunately, last week, if I'm not mistaken, or a little bit longer, there was the issue that for 24 days, around 24 days, New Zealand has 0 cases every single day. And then suddenly that stopped. And that stopped because you had imported cases, that people that traveled to New Zealand and were unfortunately positive. Thinking of how that changes the reality, because you said, okay, it's also a fact that you have people that, you know, are basically living, it's back to normal.
Mm.
And so having two cases, it, it's a bigger fear, right?
Yeah.
Than just a couple or even a lot of daily cases that, you know, it's the norm, which should never be the norm, but it's not as scary as going from 0 for a long time to 2. Taking that into consideration, can you just tell us a little bit more about, since that happened, what are the next steps? What measures has New Zealand taken with just flights coming in from abroad, and what is Australia's look into it? For instance, can I go to Australia coming from Germany, where we also had outbreaks right now,
Mm-hmm.
or just people from New Zealand can travel, and what are the measures?
So in New Zealand and Australia, the borders are both closed unless you're a New Zealand citizen, permanent resident, or family member. So the people that are the imported cases that are coming, there are only New Zealanders returning. So I could go home, but I'd have to quarantine. But say my South African flatmate couldn't fly into New Zealand. And in terms of what that means, basically, so the first two cases, they were given exemption to go to a funeral, and they like drove 8 hours from Auckland to Wellington. But that, I think, so basically since that, they've put a stop to all compassionate exemptions, which is a real shame for people that may have, you know, really needed that. So that's a bit of a bummer. So I think they're just investigating how that happened, just to ensure that it doesn't happen again, because New Zealand's so reliant on having that working flawlessly, because like you said, we've got no restrictions in the rest of the country. And so for the last few months, we've New Zealand and Australia have been in talks with like opening a trans-Tasman bubble, which would mean, yeah, we can go to and from without having the mandatory quarantine period, which looked quite promising. And there was sort of people talking, oh yeah, maybe July. But now with COVID, the cases in Melbourne, but also we need to sort out like the border situation in New Zealand, especially because like some countries have gone off, it's like for a mitigation approach, whereas I think like New Zealand has gone for an elimination approach, which is why I think when you have 0 cases for 24 days and you have then 2 or like, you know, a couple, that's a big deal. And it's a lot more of a big deal than if you are going for a mitigation approach where you're going to have that steady sort of couple of cases. It's not sort of to be expected. And so now I actually keep seeing in the newspapers saying like, oh, you know, the trans-Tasman bubble's not going to happen, and like this is the reason why. I'm like, oh, I just want to go home.
Well, yeah, it is a fear, right? Especially, I assume, how much are you or the people that, so your family and friends, are watching what's happening around the world? Because there's also that fear, right? Yes, it would be great to have between Australia and New Zealand just inflow, especially if, and obviously if you guys are in the same level, right? But there's also the fear what happened in New Zealand, but also what you're watching in Europe, in the States, and because we have seen, for instance, in the United States, one of the reason why things just have gotten worse and are getting worse is because a few months ago, there were so many flights that were still going on. So people from, you know, the north going to the south, from the east to the west. And yes, the United States is a very big country, but, you know, there's other big countries in the world. And moving around when there's a virus hanging around is, yeah. What do you say from what you see?
Well, I think we're just really lucky that we don't have the same risk traveling around, like because there are no cases. Like as soon as we went into restrictions, like sort of level 1, there were just so many sales on domestic flights. You could just jump on. They're really, really encouraging sort of domestic tourism. So I think we're really lucky.
Yeah, you
In
can
that
do that.
regards.
You can have that because
Yeah.
you took measures
Mm,
right from the beginning, right? Like,
mm.
and did the work at the beginning. Just tell us a little bit about what are your hopes, what are your concerns, what is it that you think that's going to happen in the next few days, next few weeks, taking into consideration, for instance, what's happening in Melbourne. What is it that you want, don't want to happen? And it's also quite interesting because we see your reasoning as Liv, just a person, but also Liv, that works in a public health environment.
So I think there's always like a little bit of a concern of a second wave, and I think the knowledge that if a second wave happens, you're not going to have the same compliance. You're not going to have the same, say, like if a second wave happens in New Zealand, no one's going to lock down and do what they've been told because it wasn't, their fault. If they let imported cases come in and like cause community transmission, there's no way Kiwis would just give up their job, basically sacrifice so much again after they'd been through so much. So I think there's that. There's also with restrictions easing, things is like very nearly back to normal. I think it's just concern, like you don't get too complacent and like you just sort of are still being cautious and vigilant. I think that's more mainly the decision makers. And one thing I feel like, not necessarily about the country and the government, but I just feel like I don't want to lose what I've learnt over the last few months. So almost like I hope that we sort of learn from everything that we've been through in terms of not even just like managing the pandemic, but just, I think the way we've lived in the last 3 months has made me realize like what is actually important to me. And I feel like it's been really like almost nice to be like, go back to the basics. And I just really want to hold on to some of these things. Like you don't have to be busy all the time. You don't have to have all these plans, and you can just stay at home and read a book, and that's fine. You don't, it's just.
Yeah. You don't need
like
that 10th
yeah,
dress,
yeah, and just little things like that it makes me a bit apprehensive to go back into the world. Yeah, I'm feeling, I do feel a bit anxious about sort of going back in the world as normal, because I feel like everything has changed, but then also nothing has changed. So it just seems like it's all of a sudden going back to normal, and I'm a bit like, I don't know if I'm quite ready, but it's not like I can't really put it into emotion. Why? Because there are so many things that I have missed, but actually I'm surprised that I didn't miss them as much. Like I love going out for drinks. I love going to a pub with my friends and doing all these sort of things, but it's mainly I didn't miss them as much as I thought, maybe because I still had all of the connection with the people that I was really close to, and I put more effort in spending time and talking to the people that I really value. So I hope I can hold on to that. I think
hold on to those values. And yeah, like you said, it's also okay to stay home and read a good book. And right, and also okay to understand that you don't need to consume.
Yeah.
But also it's also nice to just enjoy the moment, enjoy the people, just with the basic things, right? And of course, this always, people should keep in mind that all of these stories, while they're obviously stories about the people and the country that they're in, they're from, the countries that we're talking about, it's their perspectives, because you are someone from New Zealand that is living in Australia, you can think of this going back to normal and wishing to hold to some of the things that you have learned in the last few months. Again, very lucky. And again, something that unfortunately many people in many countries should not be thinking, because they are not in a place to be thinking about going back to normal.
Mm-hmm.
We still need to be cautious, and some countries more than others, right? But yeah, I completely understand what you're saying of understanding more what is more important, right?
Mm.
It's part of the nice things that the pandemic has shown, right?
I think, yeah, especially for people that are lucky enough to have, you know, a home where they're happy and like a job that's paying through that time. Like, I think if I was the fact, you know, I'd lost my job or something, I think that would be a whole different ball game. And I think it's a very privileged position for me to sit here and be like, say, I've learned things, that rather than spend the entire 3 months, you know, stressing about, you know, making a living or providing for other people. So also just privileged position where I am, the fact that I'm, you know, in Australia and
definitely.
my family are all safe.
Yeah, exactly. But again, just like you are privileged in your position, there are other people around the world that are also privileged. So it's nice to show them your experience. It's nice to inform them of your learnings, and it's nice to make them think of things that, you know, maybe they didn't think. You may have privileged people that are just constantly thinking, oh, I can't wait to just, you know, go partying every day like I used to. And make them wonder, you don't have to. Didn't you enjoy that book you read the other night with your glass of wine, right? Liv, it has been really nice talking to you, and thank you very much. So my day is just starting here, but your day is ending. It's time to sleep or have your glass of wine and your book. But before you do that, so before we say goodbye to each other, I just have one more question. If you could speak to Liv, so if you could speak to your future self, the Liv that will be here in 14 days, and you could give her a message, what would you tell her?
I would tell her to think about how to spend her time. Do things and see people that bring joy to your lives and lift you up. I think that's what I would say.
It's a very good message, positive, and I like it. So you will say it in 14 days, and I will see you in 14 days.
Thank you so much.
Thank you. Have a good evening.
You have a good day.
Yeah. Bye. Liv. That was your message to yourself 14 days ago, and this is the first time you see all of it, right? So
yeah, it's really, really interesting.
What are you thinking?
It was like not as hard as I thought it would be. Like I thought it would be really sort of weird, and I thought I would like cringe or like, you know, be like, oh, why did I say that? But I actually just felt like I was like, oh yeah, I still resonate really much, like a lot with everything that I said 14 days ago. yeah, so it was actually really nice.
So that means, I assume that means your hopes and concerns remain the same.
Yeah,
No?
yeah, definitely. Yeah, I think there's maybe this sort of concern about a second wave is probably a bit more real now. And yeah, but yeah, very, very similar. I wouldn't really add anything to that. Yeah.
Because yeah, like we said before I showed you this video, I spoke a little bit about the numbers, right? What was 2 weeks ago and what is now. And actually, I was looking at, okay, what was the situation also on a 7-day average? And on the 28th of June, the average new cases that week per day were around 33 new cases. So you guys had around 33 new cases each day around the time that we spoke. Fast forward 2 weeks, and now you are actually averaging around 194 new cases a day. Hence the increase, right? So we can see the increase. And 2 weeks ago when we spoke, we did speak about Melbourne, we did speak about Victoria, but we were calling it an outbreak, right? And now that whole area is on lockdown.
Exactly. Yeah. Yeah. So I think they recorded their biggest daily increase ever, like maybe one day last week, which was like 280 cases in a day. And, you know, most of these cases are now community transmission, which is like, it's more community transmission than it ever was in the first wave. And yeah, you're right. It was all these sort of like, not necessarily well controlled, but there were clusters and little clusters in different areas. And now it's, yeah, very much just the whole city on lockdown, which I think it's quite scary doing that, going into something like that when you know what to expect. So like I saw my friends in Melbourne that are, you know, because they obviously had like the sort of 24 hours before it happened. So they're all going to the gym for the last time or going out for their last, beer at the pub. And you know what to expect, which must be quite scary. It's not like, you know, it was almost a novelty to start with. You know, you're venturing onto this unknown, and it's like, it's almost a little bit exciting, whereas yeah, they know exactly what they expect. And yeah,
it's weird because you're right, sometimes you think, what's better or worse or scarier, something that you know or something you don't know, right? And in this case, it's again really difficult, because I can understand the people that, you know, go for the last beer, go for the last gym workout, go for the last everything. But at the same time, if there's community spread and you're doing all those things, you are actually risking it a little bit more, right? But then how do you balance that? How do you balance the knowledge that it's going to be difficult again for 6 weeks, all these things that you won't be able to do? And it does affect mental health, right? We've seen so many countries that they say, yes, we are trying to prevent this pandemic to get worse, but we are creating other pandemics, right? And yes, it is true, but what do you do? What do you do, right? In the end, these lockdowns, for instance, all the countries, all the cities that have not gone through or hopefully won't go through a second lockdown or even a third lockdown, they all have the same aim, right? To prevent another lockdown. But how do you do that? You have to do all those things that you were meant to do while you were on lockdown. So while the people were on lockdown, the government, the administration, the healthcare providers, like the people that had to do the work, were supposed to ensure there was enough protective gear, ensure that testing was ramping up, ensure that contact tracing as a process, as a system was in place, you know? ensure all these different bits and pieces. And if you weren't doing that, in the end, a lockdown was just pressing pause.
Yeah, for sure. Yeah.
And can you maybe, since you come from a public health environment, I know you're a researcher there, but last time we spoke that you had a lot of acquaintances, colleagues, and friends that would share with you different studies or speak about different things with you. So you had a different look from the beginning. Can you talk a little bit about what they're saying about not only the second lockdown, but also the fact of what was done or not done and what needs to be done?
That's really interesting. I think we still don't know. I think time will tell when we're able to compare different people's responses, and like there's a lot more evidence on different treatments and things now. I lost my train of thought. One thing that is interesting. There was a big study that was just published from Spain where it was a big serological study. I'm not sure if you saw that, and found only 30% of people that tested positive had antibodies, which basically that's the whole concept that the UK started operating on, we don't need to lock down, let's just go for herd immunity. That never would have worked because people that are testing positive aren't having this long-term antibody response, so which just highlights the importance of these interventions like physical distancing and which is, it's harder to get sort of that evidence for, it's not as clear cut as here, take this drug. It's easy to sort of prove and see an effect. It's less clear with that. And then also I think with masks, the use of masks is becoming a lot more sort of embedded in policy now, not so much in Australia, but in the UK it's now mandatory in most areas. And I think it's been encouraged now in Melbourne. So it'll be interesting to see if we did have a new wave in New South Wales because we didn't really there weren't that many people wearing masks for us early on, but I wonder if that would change now as we've moved with the times and evidence.
Yeah, as you see more and more studies showing that, yes, masks do help. Obviously, they're not the solution. They're part of the solution to lower the risk, right?
Yes.
But
it's not a one component intervention and it never will be. So I think
it's a combination of things.
Yeah, I think.
No, and also the fact that you need to properly wear them, hygienically wear them, because that's one thing that even here in Germany, I cringe because I see women, because it's mostly women that carry purses, and they have a bunch of stuff in there. Just very few women are very hygienic with their purses. We can say, right? It's all a bunch of stuff.
Yeah.
So coins and wallet and your keys and this and that. And then I just see people grabbing the masks without a bag or anything and separating them for whatever
Yeah, it's really interesting as well. I think there seems to be a lot of mask shaming even. So basically one of the people leading this, she's a professor in Oxford, Trish Greenhalgh, and so she's been leading a lot of the evidence on masks. And basically there's a lot of sort of criticism of people that they're not wearing the mask over their mouth and their nose and blah blah blah. If you're going to wear it, you need to wear it right. But she was actually saying that it's actually more important that you wear it first. It doesn't have to be perfect. So don't shame people for not wearing it perfectly, because they are trying, and even if it's just covering your mouth, it's still better than nothing. And you want people to be compliant and do it, and
to start do it. Yeah.
And
do it better. That is true. I admit, yes, you're right. It's not that I'm shaming, but the reason I mention is because one of the arguments that people that are against masks say is that not only doesn't they say it doesn't help, right? But they also say that anyways, the way things are done, it makes it worse. That a mask actually makes it worse. Not only it doesn't help, but it makes it worse, that there's more probability that you get it. And one of the reasons people say is because exactly, you touch everything and then it's not that hygienic, right? So my response is to those people, yes, it is true that if you don't do it well, maybe there's a little bit more of a risk. But of course, there's less of a risk if you're wearing it, even if you're not wearing it properly, than if you're not.
But also, they think like people don't realize that wearing masks, that's protecting other people. You're wearing a mask to protect other people, because it's like, you know, it's stopping the spread of sort of like droplets, which you would pass to somebody else. So that's where it comes from. So I think people maybe don't realize that as much. So it's like, that's why you want everybody else to be wearing them, because if they do have it, they're not going to be spreading it to you because they're wearing a mask.
Yeah. And the more people wear it, the better it is. And of course, that doesn't take away social distancing, right? It's not that if we're both wearing masks, we can be hugging and whispering
Exactly.
to their ears, right? And also coming back to the study you were talking about in Spain. I don't know if we're talking about the same study, because the study I read was saying actually that I was like, it was a large scale study, but it was saying it was around 5% of its population that had developed antibodies. And another thing it highlighted was something that we're hearing more of now, is that we don't know how long those antibodies actually last, because there are examples of people that have had COVID-19 and tested positive, had the disease, whether it was mild or not, and then 3-4 months later they test again and no antibodies are shown, so they can get infected again. So even if you have an antibody now, we don't know how long it's going to last exactly. We don't know.
Yeah.
So
and that's why that you could have never used herd immunity as a strategy without knowing that. Like you can't just say, yes, let's let all of our population get sick because of herd immunity, when you don't have the evidence to support it.
And you can't have it yet because everything's too new, and we're still studying, we're still seeing, and whether it's 5% or 30%, that's still not enough. One, with all the deaths and all the suffering and all the direct and indirect causes, right, that the pandemic has caused. And again, they don't last. At least for now, what we see is that it doesn't last. So it really highlights and emphasizes what you're saying, herd immunity. It was already from the beginning, in my opinion, a little bit of a cruel dream, because you're saying like what? Let the weak die?
Yeah.
And you don't even know who's weak. I mean, you don't know if you have...
you might be weak. Yeah, you might have some underlying condition that, you don't know about.
And you even have the healthy that are getting really sick or dying. Not many, yes. Compared to the rest, it's not many. But what is many? Like, what do you consider many?
Who are we to decide our number of, acceptable deaths? Like,
no. I remember around April, there was still on social media, there's still a lot of joking, a lot of memes and just jokes about the pandemic. It was more lighthearted, right? Making little jabs on quarantine and so on. And then suddenly from one day, I felt like it was from one day to another, when things really got serious, this light perspective got erased, right? And before that happened, there was one little meme that stayed with me, because it was back when people were saying, even if it's 3%, it's only 3% of the population that are going to die. Like, whatever, why should the other 97 suffer for it, right? And how can you say that? Because first of all, you might be talking about me. You might be talking about my parents or my neighbor that I say hello to every morning.
It's so easy to think like that when you're looking at percentages and numbers, but as soon as you put that into maybe 3%, that equals 3 million people.
Yeah.
I mean,
it's
that's
way too much. And this meme was perfect because it said, if I gave you 100 Skittles and I told you you can eat as many as you want or choose whichever you want, but by the way, 3 of them will kill you, which one do you want? Will you pick one?
right. Yeah.
No, forget Skittles. I'll grab popcorn or something, right? Like, it's the same thing here. So it makes it really difficult. Couple of questions about how things have changed. In our interview, you mentioned, for instance, that in a few days, in a few weeks, which would have been a couple of days ago, Queensland was supposed to open the borders to the other states. Mm-hmm. Has that changed because of the lockdown in Victoria, or do you know?
No, it hasn't changed. They still went ahead and opened the borders to, obviously not to Victoria, but it is quite funny because, you know, the Premier of Queensland was very much just like, nah, we are protecting ourselves, we're not opening borders. And she was getting a lot of shit from other premiers and like the federal government being like, open your borders. And now it's like, it almost seems like, oh, actually, you were right, you know? So I did see this like satirical sort of news article in Australia, and it's very much just like, oh, you know, just whenever you want to apologise to Anastasia, her name is like, you know, if the other premiers want to apologise to her, it's like, that would be good.
That would be good. And exactly, I mean, you need, it's so difficult, everything. Mm-hmm. But what happened, because we know you're from New Zealand and you're living in Australia, what happened with this bubble, the traveling bubble?
So it's still a topic that's been discussed, I think, quite a lot. I feel like the general consensus is that they don't want to do a bubble with just part of Australia. So it seems like
everything or nothing.
They want to do it with, you know, New Zealand and Australia entirely. So which means that they won't implement it until Victoria sort of its stuff out. And we also don't know how the Victoria outbreak look like. Second wave is going to affect the rest of the states. So it's, you know, we're a long way off now, which is really sad.
Yeah, because you haven't been home.
No, I mean, like I'm lucky. Like I had 3 weeks over like sort of Christmas, New Year's where I was home, and that was great. And I also had like my parents came in March for a weekend, early March. They ended up having to sort of quarantine at home because that was announced literally while they were here. And then I had my sister come in February, so I've seen them pretty.
You've had your intake.
Yeah, I have. It is funny. Like my parents were here. I just feel like I didn't really truly appreciate it because I was expecting them to see them like 4 weeks later for a wedding. So, you know, saying goodbye to them was really easy. It was just like, yeah, okay, see you next month. Bye.
Yeah. I totally get you. My parents live with my brother in South America. So I'm half Bolivian, so they live in Bolivia. And the last time I saw my dad in early February, he was here. And then my mom and brother, I saw them over Christmas when I spent it there. But now, like every time, like around February, March, I thought, okay, I'll see them in September, October. You know, I was supposed to see them in like May, but I'll see them September, October because things are going to get better. But then around end of March, beginning of April, I was like, yeah, before the end of the year, no way.
No,
Now
I think, yeah.
it's just getting worse, right? Like we see the pandemic, yes, you have countries like New Zealand that are doing well, that have been doing well, and hopefully it stays that way. But in general, from a global perspective, the pandemic is accelerating, which means it's getting worse globally, which means it's not ending anytime soon, right?
No. Yeah.
It's no, really difficult.
Mm-hmm.
And your prime minister, actually, the Australian prime minister, Scott Morrison, he kind of mentioned something similar, right? Because recently he said social distancing is not an exception. It's actually the norm, and it's something that should be done for a long time, all the time, until there's a vaccine that not only is produced, but distributed to everybody.
Exactly. Yeah, until you have, say that herd immunity, until you've got about 70% of the population vaccinated against it. Yeah.
So how are people reacting to his announcement? Because there's been like back and forth on like when there's going to be a vaccine, not from Australia specifically, I'm just saying worldwide, right? Some people are saying end of the year, other people are saying XYZ, but more and more are showing no, this is not temporary. This is not something of a month or two, right?
I don't know. I actually didn't even hear that announcement, but honestly, I don't think people are really socially distancing. Yeah, like it's just, well, they are technically meant to, but it just seems like, things are a bit sort of almost arbitrary. Like there'll be signs in restaurants to be like, maintain distance from everybody, but they don't. And it's very weird. Like, I've just started playing team sports again. And so when they're doing like their pre-game chat, you have to stand all apart, but then, you're for 40 minutes, you're running around touching everybody. Which is just, but then, yeah. And then when we can't handshake at the end of the game, so we did a little elbow touch, even though we've just been like, full on contacting everybody. Yeah.
Yeah. There's,
yeah. It doesn't feel that dissimilar from normal now. Like when you go out, I think people are a lot more sort of blasé about it. I think, a few months ago, if you're walking down the street, you would try and get out of the way of people that you're walking past. Yeah. Whereas it's a lot more just like the streets are sort of back to normal. Yeah.
And this is even with a whole area completely locked down for 6 weeks because it just got worse. So imagine, difficult, because it's not only there. You've seen other countries and other cities, and people just, there's this disconnect, I think, as in, the pandemic is over, or the virus is gone, or we can ignore it. We can totally ignore it, which countries like the United States have shown us that you can't ignore it, and you shouldn't, right? Look at the numbers. There are 3-point-something million cases, and it just keeps on going up. And every day is a new record. It's like a broken record.
And those are not records that you want to be getting.
No, they're not. Liv, before I ask you my last question, is there anything else that you would like to share that has changed, or about the situation, or anything really about either New Zealand or Australia or you, right? Because this is your story.
I don't think so. I think I've covered everything. There's nothing really on my mind now.
No. Okay. Let's jump to the last question. I'd like to know, so in our first interview, which we saw that bit here when I played you bits and pieces of our conversation, I had asked you to basically leave a message to the future Liv in 14 days. If you could speak to her, what would you tell her, right? And you did. And now, to end this experience that you've had with me in 14 days to change, which is your story and in the pandemic of Australia with bits and pieces of New Zealand, my question is, if you could speak to the people that are gonna watch your story, if you could tell them something, regardless if they're Australians or Kiwis, or if they come from a city or country that's doing better or worse off than the country you are from or in, if you could tell them something, what would it be?
I think to be kind. I think, yeah, everything about this is like, it's easier when we're kind to ourselves, kind to each other, and we're doing the right things and we're uniting together. So be kind and empathetic, and it makes, I don't know, fighting it so much easier.
Be kind. I like that.
And that was, I mean, copied that from New Zealand. That was like, you know, such a big part of their messaging.
Yeah. And it's a good thing to copy. I mean, I was telling somebody a few days ago, why is no one plagiarizing New Zealand? Why are they not, like, just copying? You know, do it, just copy, plagiarize. You won't get in trouble.
I know. Now's the time to look to your leaders that are doing well, and you're right, to copy them.
Just copy them. Yeah. And you can even say where you're copied. You don't even have to give, you know, say it's yours, just copy.
Yeah.
So be kind. Thank you very much, Liv. It has been a pleasure, and 14 days to change with Liv and Australia, with bits and pieces of New Zealand.
Thank you so much for having me. It was great.
Have a good evening.
You too.